as Cleveland once again tops more than 100 homicides in 1 year. We're digging deeper, going beyond the flashing lights.
We can't hide the fact that our neighborhoods is unsafe.
Adding up the numbers.
I think I still got a bullet in this leg and then in my hip.
And exposing the cost we all bear of treating gun violence in Northeast Ohio.
If you are a part of Northeast Ohio, you're somehow paying for this.
And for some, it may be easy to say gun violence doesn't affect me.
But tonight, News 5 investigator Scott Knoll shows us the enormous price tag passed along to every one of us.
On the court, he's a high-flying 18-year-old dreaming of dunking his way to the NBA. Richard Starr first noticed David Warner about 8 years ago on the basketball court at the Boys and Girls Club.
He's always been respectful, always been easy to talk to and coachable. Not just on the court, but off the court.
The kind of kid more interested in being in the gym than on the streets, says Starr. It's what made that alert on his phone September 11th a complete shock.
And I started looking at my phone, I'm like, wait, whoa, what's going on?
In the shadow of the same Boys and Girls Club where he spent so many hours.
Do I have any detectives on the air?
David Warner lay shot.
We have multiple cases in the parking lot.
It doesn't make sense, because you'd be like, I just messaged him.
An ambulance rushed Warner to the hospital. Gunmen shot him 5 times. But Warner's one of the lucky ones, a survivor, now at home in Cleveland's Union Miles neighborhood, recovering.
They shot me like down here on my lower leg right here.
He thought he was meeting friends for an afternoon movie.
When I got there in person, the whole scenario changed.
He says his friends suddenly started talking about buying a gun. After the cash exchanged hands, he says, out of nowhere, bullets started flying.
I heard my ears ringing, and then I'm just all I know is I gotta move.
His wounds landed him here at Metro Health Medical Center. It's one of 2 level 1 trauma centers in Northeast Ohio. The hospital's doctors treated more than 1,600 gunshot victims in just the last 2.5 years.
We need to talk about the equivalence of a Uvalde happening in Cleveland every 2 weeks.
Dr. Akram Boutros is CEO of Metro Health. The cost of treating gunshot victims there, nearly $80 million over the last 2.5 years. That's an average of almost $49,000 per patient. Metro Health says nearly 3 out of 4 victims are covered by Medicaid, tax dollars.
So you're going to pay for this one way or another. The idea that it's not in my backyard, it's not somebody I know, is a fallacy. It's impacting you.
Add in another 818 gunshot patients treated at University Hospital's Trauma Center, and it brings the total to 2,454 victims in 30 months, a number that shocked Starr.
Wow.
2.5 years.
That is alarming. That's a crisis.
One with a huge bill. Between Metro Health and UH, the cost of gun violence topping $106 million since the beginning of 2020. Boutros calls gun violence the Achilles heel of Northeast Ohio.
Every one of these visits is equal to a kid's college education. Could have sent them to college for free.
For Warner, college is still part of his plan, but that's down the road. First comes relearning to walk.
In my surgery, they put like a rod in my knee, and then it goes like from down to my knee all the way to my ankle right here.
For Starr, who now represents Cleveland's Ward 5 on City Council, it's a reminder of the need for action to cut gun violence in our communities.
We also got to face the reality of the neighborhoods that we live in, where it's easier for you to get a gun than to get a job.
So a lot of talk about the problem, but what can be done to find real, actionable solutions? Well, Boutros plans to retire from Metro Health at the end of the year. He then plans to help create what he's calling the National Center for the Reduction of Gun Violence in Cleveland. He plans to raise $100 million in the next 5 years, money to bring together experts from law enforcement, the medical field, and academia to create solutions the center can take to the streets to help reduce gun violence. And it comes with lofty goals.
I would love to see a 50% reduction 5 years from now.
A 50% reduction in the number of people shot.
Correct.
In 5 years.
Yes.
Achievable?
As somebody who's really optimistic, I think it's a layup.
The numbers are staggering. Our thanks to Scott for bringing them to us. Dr. Boutros says he'll start fundraising for that project in January.